For staying with us here on the AM show. We continue with a conversation started off by Roland Walker on the coronavirus. Let me just give you the latest update before we settle and speak to Deputy Director of Public Health and Head of Surveillance, Disease Surveillance at the Ghana Health Service, Dr. Franklin Asiedu-Bekoe. Let's just give you the latest update in terms of this virus. We'll start off with China. Chinese health officials confirmed the number of fatalities has reached 425, with over 20,400 people infected nationwide. Hong Kong has also reported a coronavirus death, bringing the total outside mainland China to 2. At least 180 cases of the virus have been identified outside China. Now, we know about the latest in Hong Kong. German health minister will be in London today for talks about the coronavirus epidemic. A Belgian person who was repatriated from Wuhan has tested positive for the coronavirus infection. 9 Belgian citizens were evacuated from Wuhan back to Belgium. Another Vietnamese national has fallen ill. Their health ministries say this brings the total number of infected in the country to 9. Schools in 55 of Vietnam's 64 provinces have been closed for 7 days now. Let's go to Malaysia, which has confirmed its first citizen infected with the virus. The government of the world's largest gambling hub, Macau, has asked all casinos to suspend operations for 2 weeks in light of the outbreak. Hong Kong reported yesterday that a 39-year-old man with underlying medical conditions had died after a recent trip to Hubei, the Chinese province where the virus first broke out. Where last week a man in the Philippines also died after making such a trip himself. So we hear all these going around us in the world. Taiwan has spoken out against China, accusing Beijing of keeping the autonomously governed island in the dark about the development of coronavirus. And we're following all these stories happening around the world, but we are also part of the world. And this is very much our conversation as well. Here on the AM show and indeed on the Joy News channel, we've been educating and giving information every day about this coronavirus and how we can protect ourselves. A man we've been speaking to, usually on the phone. We thought it would be very helpful if you could come to the studio to give us the latest update in terms of what we know as a country and what we're doing. So my guest is Dr. Franklin Asiedu-Bekoe. He's Deputy Director of Public Health and Head of Disease Surveillance at the Ghana Health Service. Good morning to you, Doc. Thank you for coming.
Thank you very much.
Yeah. So in terms of our knowledge of this virus as a country and how we are prepared or not, what can you tell us?
Thank you very much. Let me say that this outbreak is a very fluid outbreak. Like if, let's say, I give you some set of data and you just hold on for the next maybe few hours or a day, you realize that the data just changes. If you look at the WHO site, as at 3rd of February, we're looking at about 17,400 cases. The death is about 362. But currently now, just about 1.5 days, it's moved to 20,000, and the death has moved to 400, about 400. So it tells you that it's a very fluid situation, and the number of cases keeps on rising, number of countries keeps on rising. And let me say that Ghana as a country, we actually appreciate the threat of that coronavirus. And the ministry, through the minister, place a lot of emphasis on it. So as a matter of preparedness, to respond to that, we are following our national preparedness plan. So yesterday, around 10, the stakeholders met. We have what they call the National Technical Coordinating Committee. It's a committee made of experts from various backgrounds who actually analyze and respond to public health emergencies. So yesterday we tried to look at the Ghana situation. There's a checklist which is developed by WHO. We try to assess you based on readiness. So we looked at that. We also try to run through in terms of what we are doing by our thematic areas. In that context, you realize that somehow we are progressing, but there are more areas that we also need to improve on. So that's the general situation in country.
Give us a picture of how the board is, the various entry points. What do we have there?
Yes, let me say that yesterday, one of the things that we came out clearly is, you know, fine, the disease is mainly outside. So it's likely to come through our borders. The prominent one is Kutaka. So we have tried to put in some measures. One is we introduce what they call a health declaration form. This form actually gives more information about passengers. But then the issue is it's a form. So in that case, somebody has to put in the information. And that's how now we need to be sure how reliable is that information, so that you can actually track that passenger. So one of the things that we came out yesterday was that now you're going to take more time to fill that form and for the information to be verified. In the time past, the form is given to you, you fill and give it to us.
The form is given to you whilst on the airline? Now,
that's what we have also tried to do. Now, we wanted to make sure that we streamline the whole process of arriving and leaving, because we don't want people just struggling and pushing each other. So now, the idea is we give the forms to you in the plane, then you fill it. But then you come back to us for us to verify the form. So we're going to look at your passport, look at your form, to say that are you Mama V. So if you write Asiedu-Bekoe and I see Mama V, no. We want to be sure that where are you going to stay in Ghana.
So why has this become necessary? Is it because people are not putting the right information in those?
Yes, we try to look at some of the forms, and you realize that there could be some challenges. Yesterday meeting was a big meeting involving immigration and police and army, because we want to see how we can actually address this outbreak.
So people are refusing to put the right information in those printouts you hand over to them.
Some people, and I think that is a cautious way of trying to make sure you get the right kind of information. Because if you give somebody a form, he will put on any kind of information. But the issue is, it's not just any kind of information. You want information that we can track you when it becomes necessary. So now there are information going to the passengers that from today, there's going to be a bit of delay, because you now need to go through a very tight process of being screened. So the message will go to the passengers that you are not just going to walk through the system. But let me say that there's a temperature monitoring device in the airport. People think that is a TV. It's not a TV. That device actually checks your temperature.
There was the issue of, is that enough? Because we've seen elsewhere where people are, it looks like there's a more robust way of checking people, because we see, is it Indonesia or so, where they are spraying and things like that?
What are they spraying?
I have no idea. Because the conversation yesterday in some place was the fact that, okay, what we're checking your temperature, is that enough? So you tell us, you are the head of surveillance.
No, what I'm saying, you see,
is that enough?
It's a fever. The cardinal sign or symptom for that kind of condition is a fever. So, well, let me be clear. There are two things we are looking at here. We are looking at somebody, a passenger who may arrive at the point of entry ill or not. So, clearly, if somebody is ill of coronavirus, it's most likely that the person will present with a fever at that point of entry. And we are saying that that will be demonstrated by the use of that temperature monitoring device. So if you are ill, you cannot go through that system. You will pick. And there's also this additional form which asks you additional information, because you are looking at other cardinal signs and symptoms like cough, sore throat, and the contact. So those things will actually help us to ascertain whether a passenger entering the Ghana is ill. And that is standard across board. I mean, if you travel across the world, that's what is done. You need to check the temperature, post temperature, and also apply the health declaration form. So that is the standard practice.
Okay.
Which is that.
So the health declaration, are we checking that they provided the right information at the airport when it is handed over to officials? Are we checking before people exit?
Yes, that's why I said now it's going to be more vigorous now, because I think that first we are looking at it, but not in detail, because as I said, we have some information that some of the information being given might not be right. So now we want to be sure that every information that you get on the form is...
So this is the device that's checking the temperature?
Yes. So normally, if you have a temperature which is more than 37.5, you will see a red sign on you that tells you that you're having a higher temperature. So in that case, you'll be set aside in a holding room, and then you'll be asked a number of questions. So
have we had any incident like that since we started this upgrade and checking people?
Yeah. I mean, even 2 days ago we had one. There was this guy that had come from Germany and had come through. So the temperature was 38.2. Clearly, if you look at our case definition, it was not fitting coronavirus. But we wanted to see how our system works. So we actually picked that guy, and then we had to send him to the holding room, and then we did a lab test. Luckily, he came out as negative.
Okay.
So this system is working. If you try moving through Kotoka, and your temperature decides to go up, you
so this is an instant test.
Yes.
That gives you the results.
No, not the test. This one is a temperature monitoring device. But then the person was put in a holding room. Samples were taken. We took blood. We took throat swab. We took sputum. So it was sent to Noguchi, and the results came out after some hours, about 6 hours. That is not coronavirus.
So for all the 6 hours, you are still holding him?
Yeah.
Okay. And this is the normal routine for anybody whose temperature would go beyond 37?
Yes, normally what you did, like before coronavirus came, you try to investigate the common things that can be causing fever in Ghana. So you have to rule out malaria. You also have to ask basic things. But now in the era of coronavirus, we have to assume that it could be coronavirus.
Okay.
So in that case, certain tests need to be done.
Do we have the same device at Aflao, for instance?
We have even a different one. That one is what they call the thermal scanner. So as you walk through it, so this one is like a TV. The thermal scanner is a bit different. As you're walking past it, it's checking your temperature. So we have that thermal scanners in Asiedu-Bekoe, Aflao, and Hamili.
Okay.
But there are other sites that we use the non-contact thermometers. So it's not every part of Ghana that we have this kind of.
We've seen how porous our borders are because we've done a series on that. Do we have in the places where we don't have clear boundaries, people still can come through without going through these structures that you put up?
Yeah. So yesterday, I mean, one of the chairpersons for our meeting was the deputy commander for mitigation. I mean, to address this threats is a lot of integrated collaboration between these key sectors. So we're looking at immigration, we're looking at port health, customs. So the idea is that we're going to have this training to give them additional skill. They are not port health staff. Additional skill that will help them to early detect. So they are helping us to compensate for areas that we do not have.
So we now intend training them. But this virus is not waiting.
No, what I'm saying is that, you see, when we had the Ebola, migration, customs, port health were trained together. This is a new kind of disease, so they have the orientation. So this was more of an orientation, because you need to now expose them to what is new about this. So yesterday was that big meeting that we all met as members of the National Technical Coordinating Committee about the next direction. So it's a collaborative effort of port health, immigration, customs, all to make sure that we can detect at the point of entry.
We've heard that there are some people who will not show signs, no fever, nothing, but they will still develop later on. What's the plan? Are we following up on people who have come through already who are in this country?
Yes, apparently, let me say that. So in trying to detect a disease like, let's say, Ebola or coronavirus, so you set up your surveillance system in two ways. You say you are detecting it without and within. Without is like at the point of entry. Within surveillance system that pertains. So we are saying that that's why we send the alert to our health staff that when somebody comes with a fever, a cough, and difficulty in breathing, you need to ask the travel history. That will give you an idea that could it be coronavirus. Otherwise, you could diagnose, let's say, pneumonia without even thinking about coronavirus. So that one is trying to improve the sensitivity of our surveillance system within the country.
Okay. Have you had prompts like that from any of the facilities?
No, let me say that something is going on which I think we need to put across. You know, we put out some message that Ridge and Tema are treatment centers.
The 17 centers that you gave, but you gave these two facilities.
No, even at the information, I think it was not well articulated.
Okay.
The issue was that we said we have 2 designated centers, and the regions are also supposed to designate their centers. But let me say, it's a treatment center. It's not a screening site. So people go to here Ridge and Tema that they want to check whether they have coronavirus. No.
People just walk in to want to test if they have the virus?
Yes. So we are not, it's not a screening site. What is happening is that we are saying that we have given case definitions to our health system. Health professionals will look at it and say this could be coronavirus. In that case, tests will be done, and then let's say if it's confirmed, then to be asked for treatment. Then in that case, you have to move to a treatment site. So people shouldn't move to Tema. We have instances that somebody's child came from the US. He said, "Want to check whether it has coronavirus?" That we don't do that. That is not. We don't do screening coronavirus in Tema and Ridge.
But you should be happy about that, because at least people are aware of the virus.
Yes, it's good.
And they remember that there's Ridge and there's Tema General Hospital.
Yes, but what you are saying is that it's good. Somehow it tells the system that our is going down. It's not absolute. But what you are saying is that Tema and Ridge are not screening sites. They are treatment centers. So far, Ghana, we don't have a case of coronavirus. So there's nothing to be done in Tema or Ridge for now.
So, but you gave the information. You gave that information to us. What were we supposed to do with it then?
That's why I'm saying that. So it gives you an idea of what the country is trying to do. Assuming we have a case, this is how the case comes in. But let me say that there's even additional information. Assuming you have a case which is very peripheral, you don't need to transfer that case to, let's say, Tema. In that instant, that case can be managed at that site. So that site can become a treatment center. In that case, you now get expertise to manage the case at that point. So cases will manage as they occur.
There's a clinic at the airports.
Airport clinic.
Yes. How upgraded is that facility?
Yes. Let me say that it's good. Yeah. I mean, when the cases are seen, let's say at the on the plane, the first point of call is they put in a holding room, and then it's moved by ambulance to the airport clinic. So that they have a holding room. They have a holding room, and where then they will inform the surveillance system or the health system, and they will come and see. So the case that we saw 2 days ago was actually held in that
okay. Place. I want to bring back a press statement signed by the Ghana Medical Association, of which you are a member, and share with you, and then try and get a response. The Ghana Medical Association is concerned with this recent outbreak of the novel coronavirus in some countries, which has been declared a public health emergency of international concern by the World Health Organization. The human interactions between countries make the possibility of an outbreak of the coronavirus in Ghana very real. This, therefore, requires that as a country, we must be prepared in terms of logistics, protocols, and trained personnel to deal with a possible case. The Ministry of Health should strengthen the surveillance systems at the points of entry into Ghana as well as within the country. We call for adherence to the various international and local surveillance guidelines and protocols in all health facilities, ports of entry, as well as improved public education on the signs and symptoms of coronavirus infection in the community level. This is the urgent need for the reactivation of a well-coordinated rapid response team like the one set up during the Ebola pandemic in 2014-2015. We urge doctors and other healthcare workers who are trained as part of the response team to immediately regroup and get involved actively as we strengthen our preparedness towards any possible case of coronavirus infection in Ghana. Government on its part must adequately resource the healthcare system, including the rapid response team, all frontline health workers and other major stakeholders, to ensure we're able to contain any case to be detected. In particular, we call for the provision of personal protective equipment to all health facilities, including the private sector, reagents for testing for the novel coronavirus, and well-equipped treatment centers. There's an urgent need for an improved official communication system in the health sector to support rapid dissemination of authentic information to all healthcare workers. And that includes national and regional hotlines linked to incident management control centers to facilitate early reporting of any suspected case. Your reaction?
Yeah, so I think that the GMA is in sync with what the government.
Logistics, equipment.
Yeah. So if you try to look at it by, let's say, thematic areas, You realize they talked about trying to enhance our surveillance within and without, and that's what I said. If you look at, there have been some changes for surveillance system at the point of entry, because we didn't used to have this health declaration form. It has been introduced. We've also sent this case definitions. The case definition is supposed to help a clinician actually detect or suspect a case of coronavirus. So that has been done. I think that we talked about the government trying to provide a lot of support. And yesterday's meeting was a meeting of partners in the government. And the minister actually was there about how the government is supposed to fuel the whole response set of activities. Today is going to Parliament and is going to dialogue with his colleagues about how...
But you're a technical person. Do we have enough logistics?
No, I would say we have enough logistics, but because we are getting a lot of... We need a lot of PPEs. That's the personal protective equipment. And the minister assured us yesterday that he's going to get about 10,000 of such PPEs. Because we need to have this personal protective equipment. It gives confidence to help people.
When would that come in?
I think this week, because he asked the supplier to bring it this morning. That's what he told us yesterday.
10,000 is enough?
I think for a start. You see, let me say that when you're addressing such a threat, what you do is you do what called a stockpiling. And then when you have the event, you try mobilize it and address it. So what we want to do is that if you have this 10,000, we're going to give limited numbers to quantities to the regions and prominent health facilities, and there will be a number at the central location. So if let's say if the case occurs in, let's say, Cape Coast, in that case the direction will be there whilst we try to replenish. So I think that the PPEs are crucial, and the minister has promised to get us quite a number to address
this week.
Yes, yes.
They also talk about the rapid response team. Do we have well-trained personnel who, can be described as a rapid response team?
Yes, let me say that the rapid response teams exist at national, regional, and district. And just so Ghana, we've trained, let's say, about 80 people for the regions, and then we have about 63 districts that have actually been selected in rapid response. It's not for coronavirus. Rapid response teams are trained to handle public health emergencies. So what is done is that you try to give an orientation. So currently now, we have the rapid response teams. For case management in particular, the ones in Greater Accra, including Tema, has been reactivated. Basically, those are the ones.
But this is a novel virus, so we need particular training.
Yes, that's what I said. They have been reoriented. So the principles does not change, because the wearing of PPEs does not change.
So we have a rapid response team that's updated.
Yes. So at least for now, we have two that are actively to work in Tema and Greater Accra, but the regions are also being oriented to make sure when we have. But let me say that when you have,
do the other regions also? Sorry, do they have rapid response team?
Every region in Ghana has a rapid response team. It is not for coronavirus; it's for public health emergencies. And just a month ago, we were in Upper East, Upper West, North East, Savannah, and the Northern region to actually prepare their team for meningitis, because we are in meningitis season. So we try to kind of orient them so that their skills are in tune.
Who has access to them?
Rapid response. In terms of when you have a public health emergency, let's say the central command deploys them.
Okay.
So it's for the health system, and it's made up of several players. I mean, people who have expertise.
So we are yet to give training to those in the other regions.
No, that's what I'm saying. That rapid response team exists in all regions.
But you say for other purposes. You talked to us about the meningitis, but as specifically with this virus.
Yes, so that was more of an orientation, because as I said, the principles does not change. It's like the one we did. You end by being able to don and take off a PPE, which is the ultimate in rapid response. Okay. So the principles has not changed.
Okay, just some few seconds on this last thing, still with the GMA statement. They're calling on government to set up 3 national centers of excellence for infectious disease management and research across the 3 national geographical belts.
Yes, I think that's so. If you look at Ghana, we have like 3 epidemiological zones. So the northern, middle, and then the southern zone. So as I speak, there's a facility in northern region that was supposed to serve that purpose, which is not completed. And then I think that but the middle belt doesn't have such a facility. So it is good that going forward, Ghana is able to have such a facility so that we can actually research more into public health emergencies.
Okay, we'll leave our conversation here. The minister is due in Parliament today, so I guess there'll be more update. But we will certainly be following up on the PPPs that you mentioned. PPEs.
Personal protective equipment.
Okay. Yeah. This week we'll be following up on that. Thank you so much for your time, as always. That's the Deputy Director of Public Health and Head of Disease Surveillance at the Ghana Health Service, Dr. Franklin Asiedu-Bekoe. We will leave you with some information about the coronavirus, what you must do daily, really. It should be a habit so that you can prevent yourself from catching this virus. So all that you need to know about the coronavirus. Stay with us. You're still watching the AM Show.